Please note, the opinions expressed in this podcast are those of the individual speakers and do not necessarily reflect the views of Tri-County Orthopedics. Any medical advice or treatment recommendations discussed should always be reviewed with your own healthcare provider. This podcast is not a substitute for professional medical advice, diagnosis, or treatment.
I'm Dr. Stephen Hunt, one of the sports medicine specialists at Tri-County Orthopedics. It is my pleasure to introduce to you Dr. Charles Wang, one of our esteemed colleagues also in the field of sports medicine. Welcome, Charles.
Thank you for having me. I really appreciate the opportunity to speak a little bit more about nutrition and orthopedic surgery.
That's great. Yes. Thank you for introducing the topic. So this has become a really hot topic recently. And I would say that I don't know how much of this is necessarily industry driven, but certainly this has been a topic that we've been recognizing has become much more important in orthopedics for many years. And essentially, we'd like to discuss today sort of what are the trends in understanding nutrition and how it affects our patients, both without surgery and with surgical intervention. So let's back up a little bit and tell us a little bit more about your background and how you ended up here at Tri-County.
Sure. So I did my orthopedic surgery training at NYU. And there, we were able to take care of some pretty high level athletes at the collegiate level and some professional dancers. From there, I did my sports medicine and shoulder surgery fellowship up at Mass Gen in Boston. I would say from there is sort of when I've really started focusing and seeing how prevalent nutrition is in what we do as orthopedic surgeons. I ended up joining Tri-County through fellowship, actually. When I was up in fellowship, I was able to spend some time with the New England Patriots. And that's how I came to know all of everyone here at Tri-County was through the relationship with the Jets and everything. So I was able to, find this great opportunity and was able to come back here. And so when I was in fellowship, aside from taking care of, high level athletes and just seeing what their nutrition team and their athletic trainers do for them on a day in, day out basis, there was one experience that I really, really saw, the importance of nutrition. And that's when I volunteered to help out with the Boston Marathon. Basically, we were there all day. You see these athletes who are training year round to run, 20 plus miles. And that day was actually pretty crazy because it was like 30 degrees and pouring out. So it was crazy that the year before it was actually humid. So they're like, you want to look out for heat stroke. And then we get to the day of and it's like people are coming in like freezing to death. So while I was there, I was actually, talking to some of the other volunteers and, there's a lot of military medical professionals there. And there was one guy who there that was like a Navy SEAL. And so he trained with the Navy SEALs. And I was like, this is like applicable to what you do. And he's like, yeah, we give all our Navy SEALs like nutritional supplements so that they can last through their training, because they do like something called Kel Week where they it's hard to get through and they burn so many calories. And so he started telling me about 3 specific amino acids that they're giving every Navy SEAL, and that there's good data to show that this helps them get through it. And so I was like, why aren't we doing this for everyone? And then I would say over the past couple of years, I've noticed more and more of our colleagues in orthopedic surgery really focusing on nutrition, and they're coming out with their own companies, and it's almost like, we have these like meal prep services now where, we can subscribe to these services. So they're almost developing this service for patients who are undergoing surgery to make it easier for them so that they're more optimized for surgery. And then afterwards, they can hopefully have an easier recovery. During training, we're taught a lot about, patients who are malnourished, have worse outcomes, especially patients who underwent a trauma, especially for older patients who undergo large surgeries. And so that's something that we're hoping to sort of develop here at Tri-County, make it a well-known thing for us here in Northern New Jersey, and hopefully offer this to our patients so that they can have eventually, hopefully the idea is to have a step up in recovery and just better outcomes.
Yeah, so I'm going to unpackage a lot that you said there. So first off, we're very pleased you decided to join us in spite of being, of the Patriots lineage there. But that being said, historically in training, I agree, we were really focusing on particularly elderly and frail patients. And, the sort of nutrition we looked at was albumin, one of the lab values for protein. And so we knew that based on data, if you had a low albumin, that potentially was an indicator for a worse outcome. So that's why we would see Ensure all over the hospital. And if anybody's ever been in a hospital with a family member or themselves, they know these protein drinks were a staple for the past, 30 years. And then that sort of kind of evolved into sort of osteoporosis and vitamin D supplementation. And so I guess, how did we get to a point where now we're looking at our, obviously elite athletes have the dietitians and they're in the building of all these facilities. But how about for the average person who may not be a professional athlete, but is really, likes to exercise a lot, likes to be competitive, or the aging athlete? How do they stay on top of these things? And what have we found out recently about that in terms of nutrition and supplements?
Yeah, I think obviously the vulnerable populations, which are the, older patients and patients who had a fracture or broke a bone or have a major reconstructive procedure, are sort of the low-hanging fruit. But like you said, I think, even our everyday athletes, 20-year-old who tore an ACL, what we've seen is that, every patient gets quad atrophy, like significant amounts of quad atrophy. And the reason being is because, patients, and there's studies that shows there's patients who have had surgery, like orthopedic surgery, they have muscle wasting and atrophy of up to 20 to 30%. And that's because undergoing surgery is a stressful thing for the body. So in order to sort of have the necessary amino acids and signaling molecules, protein in the body to heal from surgery, your body ends up breaking down a lot of your own muscle to get to that point. And yes, like a healthy diet should compensate for, most of the needs. But when you're in this catabolic state where you just had surgery, sometimes you need a little bit more help. So that's where some of these supplements and the idea of these supplements are coming into play. And I think, there's not many downsides. I would say the biggest downside is probably cost of some of these supplements. Ideally, you get more and more companies that are realizing this is an issue and offering solutions, and we can come to a more manageable price point. And so make this available for every patient that we take care of.
No, that's a great point. And so, my concern always when looking at sort of some sponsored companies that come out with these supplements that they're selling to patients is that, where's the proof that this is actually going to work? And so for many years, I've quoted patients who ask about glucosamine, chondroitin, joint supplements, turmeric, where do I stand on it? And I've sort of relied on the clinical practice guidelines of the American Academy of Orthopedic Surgeons, which has been very neutral on supplements. I think on many fronts, one is question of efficacy. Some patients may get some benefits, some may not. So we couldn't really tease out who was a good candidate for that. And the second phase was, the supplement industry has sort of a dark past. It doesn't take much to get your can or jar of something onto a shelf, as long as you slap a little FDA label that this may not do what it's intended to do and may be harmful. So I think a lot of people sort of step back like myself and say, all right, if we're going to start to really recognize this and we're going to, suggest people lay out some money, because it's not generally covered by insurance, is it?
No, not to my knowledge that these are all, because they're not really, there's no standardization of it. Like we don't know what dosage we're giving these patients. It's pretty much just whatever these companies are doing on their own time and dime that they're offering these supplements. So if there's no standardization, there's not a lot of data supported right now, then insurance isn't going to really cover it. That being said, I do think a lot more data will be coming out in the next 3 to 4 years, and hopefully we can maybe find optimal dosing and even like potential side effects of this. So far, there doesn't seem to be many. I've never seen anything reported that there's a lot of detriment to doing this.
Right. And so I would agree, at least the early literature that's coming out on some of these newer blends of, to your point, it's not just about like a low vitamin D or chondroitin. These are specific amino acids that have been researched and found that can be very effective to help, the body heal and to help get it ready for surgeries. Kind of want to ask you, sort of break it down. There's sort of like a pre-op phase for some people. There's the post-op phase. And then for others, it may not be an operative issue, it may be how do we maintain good health, good musculoskeletal health? How would you break those down if you could for us?
Yeah, I would say, these companies that are offering these products now, they're recommending both pre and post surgery supplementation. So they'll usually recommend it in the 2 weeks leading up and the 2 weeks after, because that's been their recommendation of when the time window where most muscle wasting could happen. Aside from that, I mean, I think, and I've actually incorporated this a little bit into some of my shoulders patients, but for ACLs, for example, we send all our ACLs to pre-surgery rehabilitation to optimize quad activation, get range of motion back, etc. I've been starting to do that with some of my rotator cuffs and shoulder replacement patients, because I think as much as you can try to optimize their, strength and mobility afterwards, as long as it's not making them super painful, I think it's giving them hopefully a leg up. So aside from the nutrition standpoint, I do think teeing them up for surgery before and after is very important in what we do. And so that's sort of where the therapy comes into play as well.
Yeah, I think that's a great point. Obviously, we're on this nutrition tangent in terms of preparation for surgery in any situation. Even to your point, if you're not going to cure the rotator cuff tear, but if patients go in, and this I think is very similar for knee or hip replacement as well, as just examples, doing some preoperative rehabilitation, if anything, you learn some of these exercises so you don't have all the apprehension when you're recovering and you're dealing with some soreness post-op as well. Are there any specific supplements that you're aware of that, are highly recommended or that people need to be careful of, around the time of any injury or surgery?
Yeah, so there's about 26 amino acids. We break them down into essential and non-essential. So essential amino acids are amino acids that you need from your diet, because you can't readily break that down from your own muscle or from yourself to supply those. So that's where a lot of the research has been on is supplementing those essential amino acids. There's been 3 that's been shown to be some of the more important ones: glutamine, arginine, and beta hydroxymethylbutyrate, so HMB. Those are essential in times of physiological stress. And so these essential amino acids are the ones that are being supplemented in these products. These amino acids play very essential roles in everything we do, to wound healing, to organ function, to your immune function. So, the thought is, if we can maybe mitigate some of these nutritional deficits, maybe patients have lower infection rates, they have lower revision rates for re-ruptures or loosening or whatever, surgery they had done. So, my general rule of thumb, a lot of patients come in, they're like, what do you think about folic acid or something? I'm like, if it doesn't hurt you, go for it. So that's generally my recommendation. Again,
make sure it's a reputable brand that you're purchasing from. Yeah, I think that's a great point about those 3 specific amino acids. And also, I think vitamin C has been recommended for collagen health, and that's obviously critically important for wound healing, scarring, and so on. Anything that you would say, hey, look, these are things we want to stop around a time of surgery or for something elective?
I think yes, but then you're starting to get into some of the more homeopathic stuff that could potentially cause increased bleeding or increased clotting risks. So that's some of these are obviously not FDA approved, but these are things like turmeric. These are the things that you should probably stop supplementing before surgery so that you don't have an increased bleeding or clotting risk. The amino acids, though, I don't think there's any recommendations to stop or, when to restart, because I don't think that they significantly affect your outcome of surgery in a negative way.
Right. And that's sort of my understanding of it as well. And omega-3s also big popular supplement that can have some bleeding effects around surgery. Anything else that's on the future for this that you'd like the audience to know?
Yeah, I mean, I think I would just be on the lookout. I think a lot's probably going to change in the next 3 to 4 years. I think one of the cool things about our field is things are changing a lot, whether it's implants that we're doing or techniques that we're doing. And this is sort of one of the things that we haven't really looked into as modifiable risk factor for our patients, but I think it's gaining a lot of traction. So I look forward to seeing more data to support this. And then maybe from that, we can develop a more evidence-based approach and maybe start recommending or having this as an option for our patients here in Northern New Jersey. There's a lot of other options out there. It's probably a lot to go into right now. a lot of things that I've heard a lot of, but and I've tried researching a lot of. There's not much out there. BPC 157, interesting subjects, probably a topic for another podcast, but there's a lot happening, I think, in terms of trying to figure out how to optimize our patients and give them the best outcome we can. Take it with a grain of salt for right now, because, obviously we do need more data to support it and just make sure that, we're not doing any harm.
Yeah. And so I guess that brings up a point. Like, everyone, I think, is still like Ponce de Leon looking for that fountain of youth out there. And these are sort of ways that we think perhaps are some anti-aging factors, but really from our perspective in this conversation is really about how do we optimize patient outcomes for fairly routine orthopedic surgeries that we do, right? And so in terms of delivery of this, and it just kind of popped in my head, like, I've seen delivery models where it's like the physician is saying, here, buy this from us and whatnot. Have you seen other models where they're just ordering it from a third party that's totally unaffiliated with any medical practice?
I haven't, but I think, yes, that is one other thing you have to keep in mind is that, does whoever's recommending it have some financial incentive for recommending it? I mean, here at Tri-County, none of us have any financial incentive. We don't own stock or are part of any company that's offering this right now. So I think it's an important thing that patients should be aware of. And if they want to proceed with it, we can provide them the information and the resources to learn more about it. I don't think anyone is any better than any others right now, but there's about 3 companies that I consistently see offering these services right now.
Very good. Well, I think we just ran out of time for this topic. And Dr. Wang, I really appreciate you coming on.
Thank you for tuning in to this episode of the OrthoZone podcast. If you enjoyed today's episode, be sure to subscribe so you never miss an update. Don't forget to share the podcast with others who might find it helpful, and follow us on Facebook and Instagram at Tri-County Orthopedics to stay connected. We're excited to announce that our next episode will feature Dr. Claudia Ginsberg, who will be discussing how you know if you're ready for a knee replacement. You won't want to miss it. Thanks again for tuning in, and we'll catch you next time.